Hello, respiratory infections are getting commoner in ICU with the advent of the weather changes which is happening in Bangalore. So the respiratory infection can be because of bacteria, because of viruses, and rarely because of fungus and parasites. But now in this season, we have a lot of viral respiratory infections are coming, especially from the flu, influenza A and influenza B, and sometimes H1N1 and H3N2 varieties of the influenza. Those patients who come to the ICU may be requiring a lot more oxygen than average person. In this particular condition, the patient may be requiring in the ward. Once the patient is in the ICU, we give them high flow, high oxygen with a mask. Then if it is not responding, we'll be going for a special device called high flow nasal oxygen. And even with that, if the oxygenation is not maintaining mean, we may have to put a tube in the throat and connect to a breathing machine called ventilator. So even on ventilator, we give the best medication, best measures, and best ventilatory strategies. Even on ventilator, we are unable to manage the patient. Some of them will go into some kind of a pneumonia which spreads on both sides of the lung, and some kind of a high protein fluid filling will happen to the lung. It is called acute respiratory distress syndrome and ARDS. So severe ARDS, which is not manageable with the routine ventilators, few of them may require a special support by a machine called ECMO, extracorporeal membrane oxygenation, where you take the impure blood from the patient through a tube and get it oxygenated through a machine outside the body and return the oxygenated blood back to the body. It's called ECMO. So at Aster Whitefield Hospital, we have all the facilities to manage any kind of respiratory emergencies or infections, from simple oxygenation, ventilation, and even to extracorporeal membrane oxygenation.